Hello, my name is Dr. Katinka and I practice in Fayetteville, Arkansas. I am CEO and founder of the Spero Clinic. My story, my father is a chiropractor and I have been in the chiropractic world for a very long time. I have also studied really complicated neurological techniques that took me a long time to implement. And frankly, when I came back into practice, it kind of brought my numbers down because I spent so much time with patients and everything I knew, my practice was now upside down. I was questioning everything else I've been doing up until that point. So a little bit about my history. I have treated patients from every state in the US except for 3 that we're still working on, and 34 countries. 4 years ago, I met with Dr. Manuel Mazzini in Milan, Italy, and he also has a destination practice and sees people from all over the world for severe disc herniations and tinnitus, to name a few. In my case, I treat severe suicidal complex regional pain syndrome, Ehlers Danlos Syndrome, and other conditions like that. But when we met in London, we both realized what an incredible technique we had in our hand. It is brain-based, it's focusing on the neurological system, and it is simple to learn and yet incredibly powerful and almost universal in its results. We taught for the first time in New York City in 2020, pre-COVID, and 70% of our attendees stopped doing all their other techniques and switched to Catman. Also, the vast majority of our participants saw economic growth through a COVID year, and that is very unusual for our profession right now. So, Dr. Manuel, I want you to talk a little bit about why it is such a good technique to implement in practice.
Thank you, Dr. Katinka and Dr. Mazzini. I practice in Milan. I've been in practice for 30 years, and for 18 years I've been the secretary of the Italian Association of Chiropractic, where I was in charge of organizing all the seminars. So basically, I took all the seminars in the planet, and I got fascinated from the functional neurology. So basically, what I developed at the end is a technique that is based on functional neurology, but it's easy to learn and to use, because I had the gut feeling that it was too difficult to not only to learn but to utilize all the functional neurology that I learned. So basically, Catman comes from an experience, our work experience that combined. It's very easy to learn it's very easy to use on every kind of patient with every condition. We have different type of patients, as Dr. Katinka said, people that suffers, but also people that want to improve their performance. We can treat, in our clinic, we can treat top athletes or severe disc herniation, Parkinsonian, little kids, whatsoever. And because the technique is based on functional neurology, basically what we need to do, what we aim to do is to reboot the brain, to balance the brain, to reboot the brain, and to decrease the sympathetic hypertone, and to enhance the parasympathetic function, so that the brain would go in alpha waves, and during the night would go in delta waves. In such way, the patient will regain their full potential. It's very easy, because it's very easy to learn, especially the basic, so that as soon as you learn it, you can utilize it. Many doctors that learn it utilize it for life. They change their life, change their practice, because they saw the result immediately from with their patients. So they can they can see more kind of patient. They have better results. It's less stressful for our bodies as well, because we can be specific and don't lose too much energy. Patients are very happy. Patients are very happy from the start, because they understand that you're speaking a different language from other biomechanics chiropractor or osteopathy or physiotherapist. And they understand the importance of brain-based chiropractic, because they feel it immediately. Almost immediately, they reduce pain. They feel more at ease. They feel more grounded, because the adjustments reboot the brain, especially the prefrontal cortex, that allow the patient to be more in balance, more secure, more grounded. This is incredible for top athletes, but also for elderly people, because it reduces the risk to fall. We see a lot of results with Parkinsonian as well, so it's very, very useful. And immediately they feel more relaxed, because this is the effect of the parasympathetic nervous system and endorphin that almost immediately the brain produce. We saw also, especially in this terrible year, I live in Milan, so we saw many post-COVID patients, and now we are seeing many post-vaccine patients, where they have adverse results. Basically, what happens is that the brain of these people is in fear. And in severe fear, and it freezes. Most of the time, one of the hemispheres doesn't work properly, and so it creates a brain imbalance that leads to a variety of symptoms. So basically, they don't sleep well. They are very fatigued. They feel pain all over, everywhere. And especially they lose energy, and they are they are very, very fatigued. So in about 3 weeks, sometimes if they are already patient, they get results almost immediately. If they are not already patient, in about 3 weeks, 3 to 4 weeks, they get results that they don't see in 6 months, or regaining their energy and their full potential. So I urge all the doctors to come and learn Catman, because it's the future of our profession. Please, Dr. Katinka.
Thank you so much, Dr. Manuel. As he said, it is so important to us that when practitioners learn this work, they're able and ready to hit the ground running Monday morning, that they don't disrupt their current practices, and also that they know how to actually note, do patient planning, treatment plans. So we're going to teach our documentation, our coding. Both of us have cash practices. We're both very successful. I think it is very unusual for people that are on the ground running successful practices to also teach. Too many of our technique teachers are no longer in practice and not in touch with daily patient populations. We are not teaching this work because we wanted to have another career. We're teaching it because we firmly believe that this work should be passed along to more doctors and more patients. We understand that for many chiropractors, these are tough economic times, and it is our nature to constrict rather than expand when we're under economic pressure. But I believe one of the best ways to kickstart your practice again is to get more passion, new passion, a powerful technique where you can so easily demonstrate to the patient quickly that their pain can be powerfully decreased, usually the first day, if not first week. So one of our doctors was struggling and had a tough time deciding to come to the first seminar, and she had tremendous economic growth during a COVID year. If you have 2 patient cases, you will recoup the money you're spending on the seminar. So I feel that even though this is maybe an unusual time to learn a new technique, it may be the perfect time for you to learn a new technique. So thank you so much for watching this. If you have any questions, post it underneath and we will personally answer those questions for you. Thank you.